Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World and our radio show, Let's Just Talk. So our guest today is Dr. Neil Skolnik, MD, Professor of Family and Community Medicine, Sidney Kimmel Medical College of Thomas Jefferson University. He will discuss the latest treatment option approved by the FDA. And Dr. Skolnik will also discuss risk factors and the importance of early detection of CKD. Welcome to our show, Doctor. How are you?
I'm doing well today, Kathryn, and thank you for having me on with you.
Oh, you're welcome. I have more medical shows than you can shake a stick at, which I love. And you know, kidney disease is really a very important disease. So there's so many people that have it. Could you tell me how many people in this country have kidney disease?
Oh, sure. It'd be my pleasure, Kathryn. Kathryn, let me just say that thank you for having so many medical shows, because clearly it reflects that you care about your audience, right?
Right, I do.
And CKD is one of those diseases that is incredibly important because if you don't take care of it early, it can lead to dialysis, it increases mortality, it increases the risk of heart disease, and 1 in 7 people in the United States have it. What it is when the kidneys stop adequately filtering the toxins that our bodies build up naturally all day long. And if it's not taken care of early, it leads to all those consequences. And it's not just, while we know that 15% of the population have it, 90% don't even know they have it. And some people, as you alluded to, are at more risk. And people who really need to pay attention, anyone over 65. If you're over 65, 40% of people, almost half of people, have some degree of chronic kidney disease. Other people, things that are common, high blood pressure, diabetes, obesity, things that a lot of our listeners today have and struggle with. Also, as a part of that, it puts them at higher risk of CKD.
Right. You know, it's in my family. My brother died a few years ago and didn't realize he had kidney disease, lost half of his foot, ended up in dialysis finally, and then a heart attack took him. So it's so important for people to understand. I mean, we had to force him to go to the hospital, and they just don't get it. So tell us, what is CKD and who's actually at risk, and what does CKD mean?
Yeah, and Kathryn, let me just say that the story about your brother is such an important one. I'm so feel so sorry and saddened for you and your family. And it's so important that we have this show going on so that others don't go through the same experience, because it is something that can often be caught early. And in order to be caught early, it does require people being open to going to their doctor, which not everyone, as you said, is. So going to your doctor so that you can catch kidney disease early, because unlike the old days when there wasn't a lot of treatment available, there's now new treatments. I mean, we know, Kathryn, you and I know that we live in such an amazing era of science where we've had so many advances, and we can now detect kidney disease early before it causes all those consequences. And there's now new treatments available that can slow the progression of kidney disease so we can help people avoid all those consequences.
Right. And how is CKD diagnosed, and why is the diagnosis so important?
Yeah, you know, you would think for something so complicated it would be hard to diagnose, but it's not. It's really just a simple blood and urine test that allows you with a high degree of certainty to know whether or not you have CKD. And by doing those tests, you can catch CKD early. And when you catch it early, and this is where, Kathryn, to be completely honest, it's important for patients to talk to their doctors because there haven't been new treatments for 20 years. A lot of times doctors aren't reaching out to talk to or haven't been reaching out to talk to their patients about CKD. But now that new treatments are available, it's an important conversation to have. So get that blood test, get that urine test, talk to your doctor. And there have been a lot of research in this area going on over the last 20 years. And just that has culminated in the FDA approval of Farxiga, a new medicine by AstraZeneca, being approved just 2 weeks ago, a medicine that can slow the progression of chronic kidney disease, which is frankly why I'm here, partnering with AstraZeneca to talk to people. Now, no medicine is right for everyone. That's why I encourage patients to talk to their doctors to figure out what medicine is right for them in taking care of CKD if it's something they have.
And is CKD mean chronic kidney disease?
Yeah, thank you for being clear. Sometimes we forget and we start talking medical jargon. Chronic kidney disease, CKD, is the abbreviation for chronic kidney disease. And chronic kidney disease is something that, as we discussed, is silent. You don't know you have it until it's well far along. And if you pick it up early, now there's something you can do about it.
Right. You don't have to be in the situation that we were as a family. And,
yeah.
you know, I worked with the Kidney Association and Diabetes Association. So these are important things to know about yourself. And, you know, what can you tell us, what advice do you have for patients with CKD or who they think they may have chronic kidney disease? And also, especially if they're older, getting their child or their children or, you know, a friend to actually go with them to the doctor to help them to remember stuff or do even a telehealth call. So tell us a little bit about that, why that's so important.
Sure, Kathryn, you know, it's so clear you are so sensitized to people's needs through your personal experience. And you're right. We are dependent on one another. We are our family members. We have a lot of family members who don't want to go to the doctor. It's our both responsibility and privilege to be able to encourage them, or as you said, go with them. Again, we live in this fantastic age where if you're not comfortable going into your doctor, you can use telehealth. So however it is, whether it's for yourself or to go with your family member to the doctor when you're there, if you're listening to this program, you now are, information is power. And that's, Kathryn, what you're about, sharing information.
That's right.
You have that information. You can learn more by going to farxiga.com. There's a lot of information on chronic kidney disease, as well as the new treatment that is available, and to partner with your doctor to bring up CKD or chronic kidney disease, and your doctor can then help discuss with you where to go from there.
And also you know, food and digestion are a really important part of kidney disease. And I do a lot of television shows with our healthy cooking show called The Chef You and I, and have worked with the Kidney Disease Foundation and everyone to actually teach people how to cook for that person, because it's important to know. Right, doctor?
It is so important, and you're so right. We sometimes get so excited about the technical things that we don't talk about the fundamentals. You know, healthy living, exercise, diet are all critical for us in maintaining our health. So Kathryn, it is such a privilege, and just I really sincerely feel the way that you care about your listeners, and it's such a privilege to be on here with you.
Well, it's going to be on both our radio and television shows, so we're really going to get the message out for you, doctor. Thank you so much for your mission and what you're doing for patients and to prevent to prevent a further situation with kidney disease. Thank you for joining us today on Kathryn Raaker's World and Let's Just Talk Radio.com. See you soon.
Ballerina.
Sometimes all it takes to be a dad is remembering how to be a kid again. Take time to be a dad today.
Can you help me with this? My new dad teaches me all kinds of stuff.
Sure.
He helps me with homework.
That would be 3.6795.
Thanks.
Yep.
He helps me with my decision making.
I wouldn't use this one. Ever.
And he's even teaching me how to drive.
And that's why cars have bumpers.
I'm learning so much.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.
Hi, this is Kathryn Raaker of Kathryn Raaker's World and Let's Just Talk. You know, Cholangiocarcinoma, or CCA, is a rare cancer that arises from the cells within the bile ducts. Patients with CCA are often diagnosed at an advanced stage because symptoms can be nonspecific as the cancer develops. In fact, in recent survey results found that most patients waited nearly 2 years to receive an accurate diagnosis. Joining us now to discuss this rare cancer and technology that can provide important information about patients' disease is Dr. Rachna Shroff, and from the University of Arizona Cancer Center, and Melinda Bochini, who is living with CCA and can share her personal story. I want to welcome you to our show, ladies. It's very exciting what the information you have for my audience and my listeners. So can we start with Dr. Shroff first? Okay. Dr. Shroff.
Sure.
What is cholangiocarcinoma?
So cholangiocarcinoma, or CCA, since that's easier to say, is a rare type of cancer. Like you mentioned, it is a cancer that arises from cells in the bile ducts. And the bile ducts are basically the tubes or the pipes that are the plumbing for the liver. They line the entire liver, and they help bile fluid drain through these bile ducts towards the small intestine, which is how we get rid of waste and where fats in the foods are processed. And so a bile duct cancer, or cholangiocarcinoma, can arise along any of those bile ducts. Like you also mentioned, it tends to be a disease of older patients, usually 65 years of age or greater. And because of a lot of the vague symptoms that are associated with it, it does present at more advanced stages, which is why it's often associated with a very grim prognosis.
Wow, that's unreal, doctor. I want to ask Melinda, if you don't mind. Melinda, actually, what has been your personal experience being diagnosed with CCA, and how long have you had it?
Yes, I've had it for 11 years, a little over 11 years. Back in 2009, I was working as a paramedic and started having some abdominal pain, right shoulder pain, and fatigue, but I wrote it off as, part of the job. I went to my primary care doc and happened to mention this to him, and thankfully he sent me for an ultrasound, which revealed a large mass on my liver. At first they told me not to panic, that they thought it would be a benign hemangioma, but tests proved that it wasn't. So they did a biopsy and it did show cancer cells. But at the time they didn't know which kind, and so they labeled it cancer of unknown primary. And it wasn't until I had surgery to remove that tumor, 2/3 of my liver, that they discovered it was cholangiocarcinoma. And of course I'd never heard of that before, but I did enough research to know that we needed to act fast, because 3 months after my surgery, the cancer did return in my lungs. And at that point, I was labeled a stage 4 cancer patient.
Wow. And Dr. Shroff, a recent survey that I mentioned in the beginning of the show among patients with CCA highlighted challenges patients face face. Can you tell us about some of the key findings that you found out?
Absolutely. Like you mentioned, unfortunately, it's often a long road to diagnosis with cholangiocarcinoma. And so the survey you were alluding to was a survey performed by Insight, with whom we are partnered and we're here on behalf of. And it showed that over 700 patients, about 700 patients actually had a total of about 2 years, like you mentioned, from the onset of symptoms to finding an accurate diagnosis. And the other thing the survey found is that about 35% of patients were actually labeled with an incorrect diagnosis before they were diagnosed with cholangiocarcinoma. The other kind of interesting finding, and not surprising, is that not only is there a physical burden to this disease, but the mental health burden is absolutely something we need to be aware of, because about half of patients had symptoms that were really consistent with major depression. And so the psychosocial impact of this disease really needs to be taken into account by us as physicians and healthcare professionals when we're talking about a treatment care plan.
And the other question I have, doctor, is can you tell us about recent advancements in diagnosing and treating CCA? And actually, are all of your patients going through this treatment?
Yeah, that's a great question. You know, diagnosing this earlier is key, and there's a lot of challenges associated with it. Imaging techniques and such are really helping us get better at that. But I think the greatest and kind of most exciting breakthrough right now is related to biomarker testing. And biomarker testing is the idea of taking a patient's tissue sample, usually a tumor biopsy, and sequencing it, looking for different mutations that may have caused the growth and progression of the cancer. Mutations are changes in the tumor's DNA. And so once we get a sense of what the mutation profile is of an individual patient's cholangiocarcinoma, then we can personalize treatment plans and personalize therapeutic options for patients, which usually opens up more treatment options for our patients. And so getting biomarker testing for all of our patients with cholangiocarcinoma as close to the time of diagnosis as possible is really important. And it's important that patients advocate for it, and it's important that doctors and healthcare professionals know about it and do it.
The other thing I wanted to ask you, doctor, is how rare is this disease?
You know, it's rare. It's labeled a rare cancer, and we see about 8,000 cases a year of cholangiocarcinoma in this country. I will say it is much more of a global health burden. It's much more common in places like in Southeast Asia. But most importantly, it's actually increasing in incidence in this country. We're seeing more and more cholangiocarcinoma diagnosed, and so it's becoming a bigger burden in terms of cancer care, cancer treatment, and cancer outcomes.
And this is for Melinda, doctor. Actually, Melinda, what advice would you give our audience about navigating a cholangiocarcinoma diagnosis?
Yeah, so as a cholangiocarcinoma patient and director of advocacy with the Cholangiocarcinoma Foundation, I encourage patients to educate themselves about this disease and to become their own health advocate, to make sure to ask their doctors about biomarker testing early, and to also seek second opinions from experts in this disease. And mostly they can go to testmycholangio.com or the Cholangiocarcinoma Foundation's cholangiocarcinoma.org for more resources, materials, and support.
And I want to thank both of you for joining me today. You look pretty good to both of you. I mean, especially Melinda. Tell me how you're doing right now before I end the show. How are you?
Absolutely.
How are you? Are you still carrying the disease? Are you in remission or what? That's my one question that I didn't ask.
Yeah, so technically I'm not in remission, or no evidence of disease as they call it. I still have a couple spots on my lungs that we keep an eye on, and so I do routine scans and blood work to keep an eye on that. But I am doing well. I have a great quality of life, and that's why I'm here to advocate for other patients to do the same thing and ask for testing and to get support.
And doctor, would you give that website out one more time?
Absolutely. So the Cholangiocarcinoma Foundation website is cholangiocarcinoma.org, and the other website is testmycholangio.com.
And I want to thank you both for your mission and what you're doing to educate people on this disease. So important to get it out there. So you'll be on both my radio and television shows. Thank you so much for joining me today on Kathryn Raaker's World and Let's Just Talk. Don't forget to go to our website at letsjusttalkradio.com and KathrynRaakersWorld.com. Thank you so much, and we'll be back right after these messages. Thank you.
No more, it's none of my business.
No more, he didn't mean it.
No more, not my problem.
No more, she was flirting with him.
No more, she was asking for it.
No more, boys will be boys.
No more, I'll say something next time.
No more bystanding.
No more ignorance.
No more excuses.
No more.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. You know, our subject today is lung cancer survival rates. You know, lung cancer survival rates are on the rise in the U.S., and scientific breakthroughs have advanced treatment for people living with lung cancer. However, some people living with the most common type of lung cancer, called non-small cell lung cancer, do not receive testing that helps identify characteristics about their unique cancer and informs treatment decisions. A new campaign hopes to educate the public about biomarker testing. If you're living with non-cell lung cancer, one conversation with your doctor could make a difference in your treatment. Here to explain is Dr. Jorge Gomez, a medical oncologist in the thoracic oncology program at Mount Sinai Hospital in New York, and Andrea Ferris, President and CEO of LUNGevity Foundation. I want to welcome you to our show today, and how are you?
Good, thank you. Thanks for having us.
Dr. Gomez, tell us about the new survival rates in lung cancer and why they're on the rise.
The survival rates for lung cancer have changed since the early 1990s. They've increased very slowly throughout many years, probably due more to decrease in tobacco consumption. But in the past few years, from 2014 to 2018, that improvement in survival escalated, kind of accelerated. And this is probably more due to new and better therapies for lung cancer.
Dr. Gomez, what is comprehensive biomarker testing, and what should lung cancer patients know about it?
Comprehensive biomarker testing is a way for us to look at a patient's tumor and find out if they have genetic changes, what we call drivers or biomarkers, that can help us guide the best treatment. And it's comprehensive in that it should include all of the different drivers that we currently know of that have available treatments. There are many drivers for which we have treatments. There are some newer drivers for which we don't have treatments. We do find newer drivers every day. So it's very important for patients to talk to their doctors to find out if comprehensive biomarker testing has been performed on their tumor specimen. And if it has been, whether it's comprehensive, whether it includes all of the current drivers that we know of, and whether or not there is a driver that can be treated.
Andrea, tell us about the latest campaign to raise awareness about this important testing.
Yes, thank you for asking. You know, at LUNGevity, we strongly believe that all people diagnosed with lung cancer should have access to optimal care. And for people diagnosed with non-small cell lung cancer, particularly, comprehensive biomarker testing is such a key component of that access to optimal care. It's really the first step that should be taken to help to understand what's driving a person's tumor so that they can then benefit from the right treatment. It's personalized medicine at its best. You know, many of the advancements that Dr. Gomez referred to are targeted therapies, and they are specific to these driver mutations and to information that can only be found by having the comprehensive biomarker testing done. Because of this, we recently launched the No One Missed campaign, whose goal is exactly that. It's exactly what the name says. It's to ensure that there is no one who is diagnosed with non-small cell lung cancer who is missed when it comes to comprehensive biomarker testing. It shouldn't matter where a person lives or what they look like or what language they speak to know whether or not they should have the testing done. So because of this, we launched a first of its kind campaign. It's the first time that we brought together a host of pharmaceutical companies, diagnostic companies, clinicians, medical societies, patient advocate groups together behind one unified message about the importance of comprehensive biomarker testing when it comes to understanding your non-small cell lung cancer and understanding what information could be useful for you to have to make that optimal treatment decision with your healthcare provider or doctor.
And Dr. Gomez, how does comprehensive biomarker testing help inform treatment options for lung cancer patients?
Non-small cell lung cancer is a disease that obviously occurs in the lungs. It is in many patients related to tobacco consumption, but in many patients is not. So there are actually many patients with lung cancer who have never smoked. It's a disease that is fairly aggressive and can spread quickly to other areas. In general, it produces symptoms in the respiratory tract. So it produces shortness of breath, cough, and things like that.
Mm-hmm. And, you know, a lot of people are not smoking, but they're doing something else. They're thinking they're using electronic cigarettes and stuff like that, and that's just almost as dangerous as smoking. Am I correct about that?
That is correct. You know, it's nothing should go into your lungs other than air. While there are thoughts that perhaps vaping is safer than smoking cigarettes, nothing is safe when it goes into your lungs.
Right. And doctor, how does comprehensive biomarker testing help inform treatment options for lung cancer patients?
Comprehensive biomarker testing can help us in several different ways. First, it can help us predict which treatments are likely to work. And so we can really individualize the treatment of lung cancer patients by finding these genetic changes or drivers or biomarkers and say this patient should receive targeted therapy, this patient should receive chemotherapy, potentially this patient should receive immunotherapy alone. It can also help us figure out what treatments a patient should not receive. So for example, patients who have a driver mutation or change in the DNA of the cancer cells should receive a targeted therapy and should not receive immunotherapy. These tests can also help us figure out whether or not there are good clinical trials for a specific patient. Right now, the majority of clinical trials for lung cancer are driven by biomarkers. So they're not for all patients with lung cancer. They're for patients who only have that biomarker because the newer drugs now being tested in clinical trials are much more specific. They're much more individualized.
And Andrea, where can people go to learn more about biomarker testing in lung cancer?
Yes, to learn more about biomarker testing, comprehensive biomarker testing in lung cancer, I would strongly encourage people to visit the NoOneMissed.org website. There they will find a lot of educational information as well as downloadable materials that they can print out to take with them to their doctor. There are questions to ask. There's information about how to read the test results, about what a biomarker is. And I would also strongly encourage people to visit the LUNGevity, LUNGevity.org website for further information as well as additional resources to help them navigate their disease.
I want to thank you both for the mission that you do for lung cancer patients. And we want to say thank you for joining us today to inform our audience.
It's our pleasure. Thank you.
We'll see you next time on Kathryn Raaker's World and Let's Just Talk.